Hi everyone, today we're going to be talking about blood pressure and the problems you can get with your heart. So atherosclerosis is one of those problems, and atherosclerosis is caused by hardening of the arteries when cholesterol builds up in your arteries and causes these plaques to form. These plaques are very hard and rough, and they make it difficult for blood to move through your arteries. You can see in this picture here the difference between a normal artery and a narrowed artery due to those plaques forming inside the arteries. And what happens when these rough surfaces are inside the arteries, when the blood moves through them, you can get blood clots. So cholesterol is more likely to form in people who smoke, have high blood pressure, eat high fat, are overweight, are stressed out, don't exercise, and maybe have diabetes or history of atherosclerosis in their families. Here you can see a plaque in the artery wall, and blood clots can easily form. And when you get blood clots forming in your coronary arteries, that will normally lead to heart attacks. Here you see this person has had a coronary artery that's burst, and of course the bursting of that artery is a heart attack. Now the difference between what men and women experience during a heart attack are quite severe. Men will get pressure on their chest like an elephant sitting on their chest, but they'll usually get pain radiating up their shoulders and neck and down their arm, whereas women, it's quite different. In women, you'll still get that chest pain that feels like an elephant sitting on your chest sometimes, but a lot of the time you get pain in your jaw, in your back, you'll get shortness of breath, your throat will feel like you have a sore throat, and you'll feel nauseous or feel like you're vomiting. Lots of women think they have the flu or heartburn when they're having a heart attack. And it's also interesting to note that with women, after menopause, you're much more likely to get heart attacks, and diabetic women are 50% more likely to get a heart attack than men with diabetes. So here's a heart that has experienced a heart attack. This person did not survive because the oxygen couldn't get to that part of their heart. In this case, a big blood clot formed inside the heart, causing a heart attack. And here, in this case, the septum was weakened and ruptured, and that will cause instant death. So before it gets to that point, your doctor will probably recognize that your arteries are clogged by doing different tests. So what they can do is they can take you into surgery and give you a bypass graft. And what that is they take vessels, usually veins, from other parts in your body, and they try to bypass that clot, that clog, with a graft. So you see here, there's 1, 2, 3 veins taken from usually the arm or the leg, and they try to bypass the clot in the coronary artery. This would have been a triple bypass. If it gets too bad to repair, then of course you'd need a heart transplant, and there's different reasons why you would need a heart transplant, but hearts are hard to get, and so some people even get a titanium heart put in their bodies. It's not a very great solution because you have to stay in the hospital, but that's called an abiocore heart. So let's talk about blood pressures. It's very related to problems in the heart. So you can feel your pulse by putting your 2 fingers on either your carotid artery in your neck or in your arm. And children have a much higher resting rate than adults do. Blood pressure, your ventricles pump about 70 milliliters of blood every time that they contract. That's an average adult measurement. Check that out by grabbing a graduated cylinder and see how much 70 mils actually is. We know the heart on average pumps 72 times a minute, so every time pumps, it'll pump 70 mils around your body. Now blood pressure is a measurement of the force the blood exerts against the blood vessel walls. Your pulse is when you feel your blood stopping and starting in your arteries. So when we're talking about blood pressure, there's 2 types, systolic and diastolic. Systolic pressure, and we measure this with the ventricles, ventricular systole, is about 120 millimeters of mercury when it's being forced through the arteries. It's a really big push, and you've probably seen 120/80 as the average adult measurement. The 120 refers to the ventricular systole, or the ventricles contracting. The diastolic pressure, alternately, is when the ventricles are relaxing or refilling with blood so they can pump again. That's around 80 millimeters of mercury. So 80 refers to the ventricles relaxing. And the lub-dub that you hear is 120/80 change in blood pressure as the ventricles pump and relax. Now we normally measure blood pressure on the brachial artery of the arm, which is why your doctor puts the cuff on your arm and a reading of 120 over 80 is normal for an adult. Well, that depends on many factors, so you guys can try this in class with our blood pressure cuffs. You'd also note that when you're younger, your blood pressure will be higher than that. 13 to 15-year-olds will have a blood pressure of around 136 over 86. Let's talk about high blood pressure. High blood pressure we refer to as hypertension, high tension, high pressure, and that's around 150 over 100. When you have high blood pressure, you get different complications. One of those would be a heart attack. So things you can do would be limit alcohol, get active, don't eat as much salt, don't smoke, eat healthy, and try to lose some weight. And the reason high blood pressure is bad is because it puts a constant strain on your tissues, especially the capillaries. Your capillaries can burst when there's too much pressure coming into them. And when your capillaries burst in your brain, that would lead you to have a stroke. If it happens in your heart, that would be a heart attack. And the longer you have high blood pressure, the greater potential you have for damage to your tissues. Now, of course, high blood pressure is normal when you're doing physical activity, but of course your brain should bring your blood pressure back to normal with that parasympathetic nervous system. Hypotension refers to low blood pressure, so low and hypo rhyme. So hypotension is low blood pressure. That would be around 100 over 60. And having low blood pressure is not very good either. And you can get low blood pressure. It might be just a genetic thing in your family. It might be you don't have enough iron, you're anemic. It might be you're not drinking enough water, so you're dehydrated. If you have less water in your blood, you'd have lower blood pressure. It might be because you had an accident and you had lots of blood loss. Maybe you broke your leg. Maybe you're in shock. You've probably seen people go really pale after a big accident. All of those will decrease your blood pressure. And if you want your kidneys to function properly, they have to filter your blood. And if there's not enough blood pressure to filter that blood properly, then you're not going to be able to form your urine and get rid of those wastes from your body. So you need your kidneys to filter your blood, and you need a significant amount of blood pressure to do that. There's a nephron. This is the main component of your kidneys, and this is the area here where that blood filtration happens.
The inflated cuff compresses the tissues and vessels to stop the arterial pulse. As the air is released from the cuff, the blood vessel opens just enough to allow the high-pressure blood to pass through the vessel. As this blood passes, the partially compressed cuff creates turbulent blood flow. This turbulence can be heard by placing a stethoscope under the distal end of the cuff. At this pressure, we are reading the systolic pressure. As you slowly deflate the cuff, there is less compression of the vessels, and the blood flow becomes less turbulent, so the sound is no longer heard. The diastolic pressure represents the pressure exerted on the walls of the arteries when the heart is at rest. Remember to fully deflate the cuff when finished.
So let's talk now about the factors that can affect your blood pressure. The first of those is vessel diameter. The larger the diameter of the vessel, the slower the blood will move through it. That would be low blood pressure. Think about a hose. When you squeeze it off, the blood pressure increases. So vasoconstriction, or constricting the size of your blood vessel, will increase your blood pressure. Vasodilation will decrease your blood pressure. How thick or viscous your blood is also has an effect. So the more pressure is needed to press something like honey through a tube, if you think the less water you have in your blood vessel, the more viscous or thick the blood is, and so your blood pressure has to be higher. You need more blood pressure. Versus when you have lots of water in your blood, or it's not as thick, the blood is thinner, then it takes less blood pressure to force the blood through that vessel. The next is total blood vessel length. The more fat you have in your body, the more blood vessels you have, much more blood vessels, and that increases how much resistance the blood has to deal with as it moves through your blood vessels and increases the overall blood pressure. Vessel elasticity also affects blood pressure. The more elastic your vessels, the lower your blood pressure. The harder they are with atherosclerosis, the higher your blood pressure. Blood volume is also affected. So the less water you have in your blood, the lower your blood pressure. So if you sweat a lot and you lose a lot of water from your body, your blood pressure will be lower. On the other hand, if you eat lots of salt, then your body has to keep absorbing water into the blood. More water into the blood, more salt and water into the blood means you have much higher blood pressure, which is why you shouldn't eat too much salt. So you retain water when you have too much salt. That increases your blood pressure. And when you have reduced blood volume, you lose a lot of blood due to an injury or due to excessive sweating, your blood pressure is lower. Cardiac output, that's the speed of your heart rate. So of course when your brain tells your heart to speed up, your heart rate increases. That means also higher blood pressure. And when your brain tells your heart to decrease, that will decrease your blood pressure. And of course age is a factor. The older you get, the less elastic your blood vessels are and the higher your blood pressure. So as you get older, your blood pressure will increase. And stress is another big one. The more stressed out you are means the more constricted your blood vessels will be, and that is intentional because you want to increase your blood pressure when you're stressed out so you get more oxygen to all of your body parts. So vasoconstriction, when you're stressed out, the brain causes that. That will increase your blood pressure. When you're calm, you have nice low blood pressure. So make sure you come to class with all your hot questions about blood pressure and the problems that you can get in your heart.